we go. Okay. All right, so we tried to go live on Facebook and had some technical difficulties, so I'm recording this and I will upload it to Facebook shortly. So what we were talking about was doing an antibody test and see how that turns out.
Sure. So, antibody test, and what we, at least in my clinic, I like to say antibody screen, because the antibody screening is not diagnostic. While it tells you if you may have been exposed, early on using IgM or even built IgG antibodies, which are kind of like your long-term antibodies, it's really not diagnostic. There is a margin of error, and it really just depends on which antibody screen that you use. So we'll talk a little bit about that, but let's go ahead and go through the actual screening piece, because that takes 10 minutes for us to get the answer, and then we can talk during that time about the difference between antibody screening, when you should do it, and when you should do the actual molecular PCR testing. What do you think?
Okay, sounds good to me.
All right.
So what are we going to do?
So, well, it's just a simple finger stick, very much similar like a finger stick for blood sugar testing.
Okay,
and
I'm familiar with that.
You're familiar with that. So I've washed my hands already, but I have some gloves here.
Okay.
There's multiple types of antibody screening tests, and majority of the ones that are out there on the market today tell us if you have IgM antibodies or IgG antibodies. The IgM is kind of like the acute phase. Are you acutely sick? And the IgG kind of tells us, is this are you building longer term antibodies? And that's the big question, right? Because this is a novel coronavirus, and novel being new, we don't really know how long it's going to last. Which hand are you? Left or righty?
I'm right.
Okay, so you want to do your left or right hand? Let's do the left hand.
Let's do left.
Okay.
So
nice
he has
and warm.
like all of this stuff down here
Nice
on the
and
table.
warm.
You can't see it, but
Yeah. I'll show them here in a second. Here, we'll let that dry, clean off the spot. This here looks very much like a pregnancy test.
It is not.
It is not.
It's not.
That's awesome.
And yes, he's poking my birdie finger.
There we go. And yes, we have the birdie finger.
Yes.
1, 2.
That didn't even hurt.
Yeah, I'm gentle.
Yay.
I'm a doctor nurse, right?
That's very good.
So.
I'm impressed.
And then, very much like science class back when you were in high school.
I'm bleeding.
Yeah, well, that's good. It's better than having to squeeze everything out there.
No, I don't have a problem with that. I am a bleeder.
Okay. And then, if you put a little pressure on that for me.
Okay, got
What
it.
we do is we put a little blood, so it's a serology test,
Okay.
in the test cassette, and then I'm going to use a buffer. And that's going to let us identify the control. And see, this blue line here is our control. So as the buffer mixes with your blood, it's going to turn the control pink. And if that's the case, then it actually means that it's working correctly, right?
Okay.
And so then if it's if you have a single line, we're going to look at the single line being IgM or IgG. You could actually have both IgM and IgG. And so what does that mean? So reality is, with all the different tests that are out there today, we don't have any consistency on the detection and when it's going to be able to detect the antibodies. Partially because we're all our own individual. Our immunity systems are different. So the literature package for this particular test says that if you've been exposed to COVID-19 within 3 to 5 days, the IgM antibody should, if you're building antibodies, test positive.
Okay.
And so what we say is screened positive, because if there is a positive IgM, IgG, we want to make sure that it's accurate, so then we combine it with a molecular RNA swab, so the nasal swab. It's actually a nasopharyngeal, so we kind of get way back in there. And just to make sure all that is, they correlate, the results correlate together, because there's false positives and false negatives. I mean, you hear about this quite a bit in the media. And so we want to kind of keep control of that to make sure that our testing is as accurate as possible.
Okay.
So these little tests here take approximately 10 minutes depending on which one you purchase. So some are 10 minutes, some are 15, some are 45, but they're rapid tests. Some of the hospitals and some of the labs can actually do a blood draw and do a different kind of test that takes a couple hours. The hospital can do a nasopharyngeal swab, and because they have the equipment, they may actually be able to do the molecular PCR, the RNA test, within a few hours as well. But that's kind of left up to the people who are symptomatic, the people who screen positive for COVID-19. We're seeing a lot of people wanting to get a test. Mm-hmm. So the screen for antibody says, okay, you've been exposed, according to your body saying that you're building antibodies, but we still don't know if you have the virus or not. If you have IgM antibodies, the chances are, by itself, the chances are is you're actually shedding the virus. You actively have it, even if you don't have symptoms. This is the problem with masks. Everyone wants to take their mask and fix their face. So if you have IgG only antibodies, this means that you're kind of past the acute phase, or it should mean that you're past the acute phase. So if I do a swab on you, mm-hmm. and it comes back negative, then it's right. But what if it comes back positive? You know, and so that's the question, and leads to some of the uncertainty with all these screening and tests that are out there. Because the residual RNA can be there for quite some time. So if I was to show an infographic of our antibody screen, it would say that from 0 to 7 days of first being exposed, at that 7 days is when you will start to see noticeable IgM antibodies. And so those IgM antibodies should show positive from 7 to 21 days. Well, at roughly 21 days, or 14 days, 14 to 28 days, you're going to see the IgG antibodies go up. At 28 days, the IgM should be low enough where it's not detectable, but you should still be detecting the IgG. Mm-hmm. And so by detecting the IgG, that's the long-term antibodies. IgM's the very first antibodies our bodies make. So that's kind of like the warriors going to fight the initial onset of a foreign body in your own body. What we don't know is how long those IgG antibodies last. Now, I read some literature from a study in Thailand from the SARS-CoV virus, which is, this is SARS-CoV-2. In the SARS-CoV virus, the antibodies lasted to be 3 years. Now, any epidemiologist or researcher out there would probably, let's just say some not so nice things on social media about that kind of comment, but, that literature exists. Right now, we have uncertainty. Is it 2 months? Is it 3 months? Is it 1 year? Is it 2 years? I think at the end of the day right now is we just really don't know. And so that's why all the precautions. But still, the flu is still contagious and the COVID-19 virus is still contagious. So by looking at more tests, by looking at more people, we will see more people being exposed. We want to see that. We want to see what the true breadth of this virus entails, right?
Well, we're certainly seeing more exposure based on the numbers.
Yeah.
The numbers are pretty scary. It's also confusing. I mean, it's pretty overwhelming. And, and I have to be honest with you. And I debated whether I was going to be honest about this or not. But, all that stuff that you just said about the test was just blah. It just blows my mind. If somebody were to say, "What did he tell you?" I'd say, "I don't know. Go watch the video. I don't know what he said."
Good. So
it's just overwhelming.
The antibody screen in itself. Mm-hmm. Were you exposed or were you not?
So okay, stop. Yes. Stop right there. Stop. Okay, so was I exposed or was I not? Because actually, I thought, well, I should have the antibody test because I thought that maybe I had it back in January. However, we talked about too that if I had it in January, it might show up positive and it might not because, like you said, they don't really know how long the antibody stays. But then as you were talking, I thought that I heard you say something that insinuated that if I've been recently exposed and haven't contracted it yet, it could possibly be positive too. Is that right?
No,
Did I
so-
understand that right?
So before I got stopped.
Okay, I'm sorry.
It's okay. So the exposure and the contraction. So you have to be exposed to the virus and then you have to contract the virus
In order for this.
in order for this to show anything.
Okay.
This is your body's response
Okay.
to a foreign body.
Okay.
Okay, so whenever you get a cold, get the flu, then your body responds to it. You have
Right.
increased white blood cells, etc.
That's right.
Well, part of that response is, does your body make antibodies, warriors,
Right.
to fight that off? So
Should it come visit again?
should it come visit again?
Gotcha.
Exactly. And so when we get an influenza vaccine, the concept is you get the flu vaccine every year. It's designed to cover X number of strands of influenza. And if you get the flu vaccine, your body will build antibodies. And then if you are exposed and contract that influenza virus, then it won't be as bad or maybe not at all. You'll have enough antibodies to fight it off without getting sick, right?
Right.
We also know that that's not always 100%. It's usually more like between 46 and 52%.
Right.
Okay? So that's why some people do it and some people don't.
Right.
Sound familiar?
Yeah.
Kind of like right now, right? Some
Yeah.
people are and some people aren't. I'm not going to have a debate on right or wrong, okay?
Right. No, we're not going to
But
do that. For
what
sure.
we can say is it is an infectious virus. And from a science perspective, we want to know how many people are actually exposed. In other words, exposed and infected with the virus. Some are be symptomatic, some are not going to be symptomatic. Listen, this has been really draining on the medical profession.
I can only imagine. I mean, it's draining on me, and I have nothing to do with it. I can't
It's-
even imagine.
It's frustrating because we're helpers and we're healers.
Right. Right.
And I found out yesterday that, an acquaintance, but a friend of our rugby family lost their husband rather quickly due to COVID-19. Local.
Oh,
And,
no.
and we're very close to the families when our kids were in high school. Very close rugby family. And, it's a reminder of how real this is because he's younger than me. Right?
Yeah.
And so it reminded me of how important it is for us to build our immune system, to make sure we have the right diet, have the right vitamins, vitamin D and zinc, omega-3, there's just so much out there that you can do to improve your immune system that we didn't do on a daily basis. Oh, just take some vitamin C, drink a glass of orange juice, and it's not that. So
I catch myself being much more cautious with people who do that around me now.
Yeah.
I went to the store before I came here. I went to the store, and there was a lady in there. She had a mask on, but she was coughing and sneezing and clearly sick. I mean, like clearly sick. And that's the first time that that's happened to me. And, since all this has happened. And I caught myself wanting to go over and say, honey, you need to go home. Like, what are you doing?
Yeah.
What? I mean, I don't think she had COVID, but I don't
Sure.
know what she had. But
right, well, because common illnesses are still common.
my hands on my face.
I have to remind our, some of the providers that I work with, and colleagues. I have to say, look, you just can't just jump to COVID because what if you miss something else?
Yeah.
You know.
Yeah, that's true.
You know, sure, COVID-19 wipes you out, but what if you miss a sinusitis that's bacterial? What if you miss a pharyngitis, a sore throat, that, you know, tonsillitis kind of thing, that is
Yeah.
bacterial? And you
Yeah.
know, what if you know, you think it's COVID, so you just rush through it, you do a nose swab and stuff like that, send them on their way, but you didn't look in your throat, and it's a tonsillar abscess.
Well, one of the sessions that we had, we talked about one of my friends in Georgia who ended up having pertussis. And was horribly sick, you know, and we all assumed for some time that, you know, that she had COVID, but she indeed did not. So.
Yeah. So it takes multiple testings, multiple modalities for it to, you know, to do it. And then you have to go on symptoms too, and, you know, the viral illnesses are still there. They're not all COVID-19. Reminder, 7 coronaviruses, 4 of them are common. They make up 10 to 30% of our upper respiratory infections. And now you have COVID-19. You know, I would say COVID-19 is going to be around for a bit.
I think so too.
Okay. Viruses have been living for a lot longer than we have. Yeah. I don't think we're going to, you know, get rid of this. Okay. But our bodies will adapt. We're an adapting species. And, you know, there we are.
It. We're going to have to deal with it, and we don't have a choice.
Sure.
All right, so I'm known for being impatient.
Known for being impatient.
Kind of my thing. I'm a little impatient. And so this thing legit looks like a pregnancy test. It really, really does. I swear to you, I am not pregnant. I can assure you I am not pregnant. But it looks like a pregnancy test, for real, for real. And I just keep looking at it. I don't know if you noticed, but I just keep like looking down, because I'm super duper impatient.
The control works,
what is
but
that?
You have no IgM or IgG antibodies showing.
So I have no antibodies. So
you have no antibodies.
Maybe I did, maybe I didn't back in January, but I certainly haven't in the last little while.
That's correct. So
I would have had to
with
have
the
had
level
the active
with
virus.
the level of certainty, but not 100% certainty.
Okay.
And I think that's part of the confusion is everybody wants to know, well, why do I have this cough? Why do I have this sneeze? Why do I have this fever? Why? And you know what? Just because you do doesn't mean it's COVID-19.
And anybody who was sick, because I know lots and lots of people who were sick in, you know, November, December, January, February, before all this happened. So anyone who was sick back then, even if they take the antibody test, it doesn't necessarily mean, you can't tell. You just can't tell at this point whether you did or you didn't.
That's
correct.
Right? That's correct. So it's a screen.
Yeah.
Okay? And it's a tool. It's another instrument that your medical provider can utilize to help you be as healthy as you can be, right? And to look at risk factors and those kind of things. So, you know, so there's multiple benefits to doing it, but it's not factual. Even doing the molecular PCR testing, the nasopharyngeal swab, not 100%. But again, with the level of certainty, if it's positive, it's positive. If it's negative, it's most likely negative than positive, but not 100%.
Okay, it's too much for my brain.
Right?
It really is. I mean, it's just too much, which is one of the reasons that I didn't have it done before, because I was just like, okay, it's just too much.
I think the important thing is this just tells us we still have to remain vigilant.
Yeah.
In our activities on a daily basis. We need to use precautions. We need to make sure that we're protecting ourselves. We want to protect our communities, but we had to do that before COVID-19 came too.
Yeah.
You know, whenever someone thought they had the flu, you didn't get up in their face and talk to them, hug them, kiss them.
Right.
You know, you social distanced, right? Or at least you should have.
But we weren't as vigilant, as we are now. Like I said, before I came over here, went to the store and there was a woman who was clearly sick. Clearly sick. Not just allergies. Like your little cough, probably allergies or the Sahara, mummy sand that's out there. But this lady was clearly sick with something, and even though it was obvious she was sick, I don't think prior to this that I would have been as alarmed as I was. I know I wouldn't have.
Well, sure.
I wouldn't have really thought about it. I would have probably given her a little side eye, but not like I had to stop myself today from being that person, you know, that was, no, I didn't, I didn't, and I wouldn't, but, I don't know what people are thinking going out, you know, when they're sick now.
I don't know what people were thinking when they were going out sick before.
Yeah, true, that's true, that's
okay.
true.
And
Valid,
so,
valid
you know,
point.
that's it.
Yeah.
And, you know, technology is a beautiful thing.
Yeah,
And if utilized, can
Yeah.
do a lot of good for people.
yeah,
Physically, mentally, emotionally, financially, even spiritually, okay? But if we don't utilize it correctly, if we don't communicate the benefits of the tools that we're using, if we don't break it down to a level that can be understood by everybody,
yeah.
then we risk causing panic. And I think we have some of that risk now, and we have some of that panic now.
Absolutely we
And
do.
so people are making decisions based off of
Agreed.
secondary sources versus primary sources.
But how do we even know? We can't go down
We
that
can't
road.
go down that road.
Yeah, we're
Talk to your
we're
provider.
at 21 minutes. We
Your-
better wrap this
yeah,
joker up.
Yeah, talk
'cause
to your
we keep
provider.
talking.
They have years of education.
Yeah.
Doesn't make
Listen to
doesn't
your
mean
doctor.
them.
Listen to your provider.
You know-
A lot of us are not listening to the right people. You know,
And listen to your body.
and listen to your body. I agree with that.
Absolutely.
All right, I want to ask a question before we sign off here. So this little pregnancy test thing, obviously, you know, you can buy a pregnancy test, legit pregnancy test, over the counter. Can you get these over the counter, or is this something you need to go to your provider to get done?
That's a great question. And many primary care providers do not have these because of the cost.
Okay.
I'm blessed in the fact that I lead a COVID task force. I negotiated to bring these tests in for MedFast urgent cares, and so I have enough for my patients. But we kind of saw the writing on the wall, and that's kind of the neat value of being a doctor of nursing practice with some epidemiology study that goes along with it. So we're just kind of glad that we were kind of prepared and we didn't delay in our decision making process.
Yeah.
So not everybody has it, but call, ask. Just understand that there is a margin of error with it. It's really more of a screening tool, not a diagnostic tool.
Right.
So don't just sign a piece of paper. Read any piece of paper that talks about screening and testing when it comes to the COVID-19 and any medical procedure.
Yep. Yep. Well, sounds good. And I appreciate your time, as always. I'm glad I finally got this done. And if you're looking for a provider that you can trust, there's your man. So,
Thank you, Janice. Appreciate
yes,
it.
absolutely.
So everybody remain safe out there. Take care of yourselves, your family. Keep your body strong. A lot of that starts with lifestyle change, and food's the best medicine. So eat right.
Thanks.